The Dryden Area Family Health Team provides primary care services, treatment, follow-up, chronic disease management and prevention, and health promotion prevention and mental health counseling services. In a team approach to care, you have access to a variety of professionals who have different focuses. They can spend more time with the patient. They have the resources for the patient to access and to provide that care that perhaps in a solo practice you perhaps wouldn't have the access to or the time as well. The team is made up of nurse practitioners, it's made up of physicians, dietitians, certified diabetes educators, mental health counselors, clinical pharmacists, administration. We have funding for a clinical psychologist.
The Dryden Area Family Health Team was initiated approximately 4.5 years ago. It was initiated by the Dryden Regional Health Centre, the acute care, by the physicians in town. And so they developed a business plan, submitted to the ministry, and then at that process we started our hiring process and engaging our staff.
The real driving force behind the family health team at that time was a recognition that we can provide a collaborative approach to care, provide this quality approach to care, and helping to better the health of our individuals and residents that are living within our community, especially as it relates to chronic disease management and prevention.
This is our team. So the first thing we did was we hired a team, we engaged our team, we engaged our providers, and we built a building. So here's a picture of our building.
So we've defined a program called It's Your Health.
And this program is focusing on empowering the patient, empowering the families in our community.
And the program focuses on 3 components.
This is our group-based program. It works with new moms, it works with families, with patients, individuals in the community.
So the first component, Healthy Living, works with patients in a health promotion and prevention field, dietitians and nurses, pharmacists, mental health workers, work with the patients on promoting health and providing resources and tools for the patients to improve their health and the health of their families as well. So we offer education sessions, nutrition, stress management. We offer safe alcohol guidelines, activities, physical activities. We have a great new program called Healthy New Beginnings, works with the new moms that have just found out that they're having a baby. So it's like a prenatal program.
Second component of our program called Manage Your Health, and in this program it is a chronic disease management and prevention program.
So we focus on chronic diseases such as arthritis, asthma, COPD, hypertension, diabetes, lipids. And what we do within this program is we provide patients with self-management tools. Different providers come into the different programs. Both Healthy Living and Manage Your Health are group-based. We will offer individual as well, and they work with nurses, dietitians, pharmacists, mental health workers. The nurse practitioners and the physicians all have a role within the chronic disease management prevention with the patient.
For the patients that have more complex issues where they have more than one chronic disease, we then move them through the program with a navigator. So the navigator meets with them first, they goal set, they determine where the patient's at. Really it was about meeting the patient's needs, and then they worked through the program. We're all on the same electronic record, so that information is shared from provider to provider, so everyone can see what the goal is set for that patient.
We work on working with the patient where they're at, helping them within their family structure and within the community. So goal setting is an important aspect of the Manage Your Health program.
The final component is your individual health. It's your health toolkit. This is where we make sure that you have your personal resources, you have your supports, you have your goals, and you may go into our hypertension program, but we still need to meet with you individually.
We then went out into the community, and in 9 months we met with 2,372 individuals within the community.
We went into the workplaces, the schools, the senior centers, the supportive housing units.
We wanted to hit all 3 generations.
We worked with our providers, we worked with our community, with our community partners. We met on one day there, you see pictures of kids, we met with 1,500 kids.
And provide them with the tools and the care in the community so they understood what the family health team could provide for them. Last year we focused on diabetes prevention. This year we're focusing on cardiovascular and stroke prevention.
We empowered the families to ensure that they had that support structure. We built community capacity to ensure that they had access to the quality care that they needed to support their health.
Our final piece was the follow-up back at the centre, back with the family health team, to ensure that the patients we met in the community still had that follow-up piece, that linkage back to the team, so they understood and were able to access services.
So if we met you on the community and you had high blood pressure, then we also followed up with you within our family health team and brought you into the continuum of care as well. So that follow-up piece is really critical.